7 early signs of bone cancer you should never ignore. Bone cancer is rare, yet it claims thousands of lives worldwide every year, often due to late detection. Bone cancer develops when abnormal cells grow uncontrollably in the bones, weakening them and causing severe pain or swelling. Imagine a healthy man in his 40s suddenly feeling persistent leg pain, dismissing it as a sports injury. Months later, he learns it's bone cancer, already in an advanced stage, making treatment more difficult and risky. It can occur in any bone, but is most common in the pelvis, arms, and legs, affecting people of all ages. The challenge is that early symptoms are often mild, vague, or mistaken for common issues like arthritis or muscle strain. This makes timely diagnosis difficult, leading many cases to be discovered only when the disease has already progressed significantly. Did you know that survival rates are much higher when bone cancer is detected early and treated promptly by specialists? Recognizing warning signs early can help you seek medical advice before the cancer spreads and limits your treatment options. In this video, we'll uncover 7 signs and symptoms of bone cancer that you must never overlook for your safety. Some of these symptoms may seem harmless, but ignoring them could lead to devastating consequences for your health and future. Stay with us until the end, as even one symptom could be the key to saving your life or someone you love. 1. Persistent bone pain. One of the earliest and most common signs of bone cancer is pain that does not go away with rest. At first, the pain might come and go, often worse at night or when using the affected limb more. Over time, it becomes constant, sharper, and more intense, even when you are sitting or lying completely still. Unlike pain from an injury, which usually improves over days or weeks, bone cancer pain often worsens progressively. This happens because the cancer cells weaken and damage the bone tissue, creating pressure on surrounding nerves and muscles. Many people dismiss this discomfort as arthritis, muscle strain, or growing pains, especially in teenagers and young adults. However, ignoring continuous bone pain could delay diagnosis and allow the disease to advance to dangerous late stages. Ask yourself, have you been experiencing unexplained pain in your bones for weeks without any sign of improvement? If so, it's essential to see a doctor and get the pain checked with proper imaging and medical tests. Remember, catching this symptom early could be the first step in protecting your bones and potentially saving your life. 2. Swelling or lump over a bone. Another major sign of bone cancer is noticeable swelling or a lump developing over a specific area of the bone. In the early stages, you might not see visible swelling, but you may feel tenderness or a thickened area. As the cancer grows, the swelling becomes more obvious, often warm to touch, and sometimes accompanied by skin redness. This happens because the tumor expands inside the bone and pushes against surrounding tissues, muscles, and skin layers. Some lumps may be hard and fixed, while others may feel softer depending on the tumor's location and size. Many people ignore these lumps, thinking they are harmless cysts, sports injuries, or insect bites, delaying medical attention unnecessarily. But a swelling that keeps growing without any injury or infection should never be taken lightly at any cost. If you notice a lump that gets larger over weeks or months, it's a signal to act immediately. Getting it examined through X-rays or MRI scans can help detect bone cancer before it spreads to other areas. Early diagnosis here can make all the difference between a simple treatment plan and a fight for survival. 3. Joint stiffness or limited movement. Bone cancer near a joint can cause stiffness, reduced range of motion, and difficulty in moving the affected limb freely. This happens because the tumor affects not just the bone, but also nearby muscles, tendons, and joint structures. As a result, you may experience discomfort, tightness, or a feeling that the joint is locked or jammed. You might struggle to bend your knee, rotate your shoulder, or perform basic tasks without discomfort or resistance. This stiffness can be worse in the morning or after periods of inactivity, making daily life increasingly difficult. Some people mistake this for arthritis, sports injury, or simple aging, delaying proper medical evaluation and losing valuable time. But joint stiffness that appears suddenly and worsens over weeks should always raise suspicion, especially if no injury occurred. Have you noticed you can't move a limb like before, and stretching doesn't seem to help at all? Such symptoms could indicate the tumor is interfering with normal joint function and requires immediate medical assessment. Early treatment here can help restore mobility and prevent the cancer from spreading to nearby bones and tissues. 4. Unexplained bone fractures. Bone cancer weakens the bone structure, making it more likely to break even with minor stress or injury. You might experience a fracture from a simple fall, bump, or movement that normally wouldn't cause significant damage. This happens because cancer cells replace healthy bone tissue with weaker, abnormal tissue that cannot bear normal pressure. In some cases, the fracture itself is the first clue that something serious is happening inside the bone. People often assume it's just bad luck or fragile bones due to aging, without realizing it could be cancer. If you've had a fracture without a clear cause or from a very low-impact event, it's a red flag. This symptom is called a pathological fracture and is strongly associated with bone cancer in both adults and children. A doctor may order X-rays, CT scans, or bone biopsies to determine if cancer is weakening the bone. Ignoring such fractures could mean missing a crucial early sign and allowing the disease to progress further. Your bones should be strong. If they're breaking easily, it's time to find out exactly why immediately. 5. Fatigue. Constant tiredness that doesn't improve with rest can be another warning sign of bone cancer in many patients. This type of fatigue is different from everyday tiredness after work or exercise. It's deep, ongoing, and overwhelming. Cancer cells consume a large amount of your body's energy as they grow and spread, leaving you exhausted daily. Additionally, bone cancer can cause anemia by affecting bone marrow, which reduces red blood cell production in the body. This means less oxygen reaches your organs and muscles, causing weakness, dizziness, and shortness of breath even during light activity. Many people blame stress, busy schedules, or poor sleep for their exhaustion, ignoring the possibility of something more serious. If you're feeling drained for weeks without a clear reason, it's important to pay attention and take action. Ask yourself, when was the last time you truly felt energetic and refreshed after a good night's rest? If fatigue persists alongside other symptoms like pain, swelling, or weight loss, it's worth getting checked by a doctor. Early recognition of fatigue as a cancer symptom can lead to quicker diagnosis and more effective treatment options. 6. Unexplained weight loss. Losing weight without trying can be a serious and often overlooked sign of cancer, including bone cancer. When cancer develops, it alters your body's metabolism, forcing it to burn more calories even when you're resting. This unintentional weight loss often happens because cancer cells consume nutrients that your body needs for normal function. People sometimes feel proud of losing weight easily, but in this case, it can be a dangerous red flag. If you drop several pounds in a short time without changes in diet or exercise, pay close attention immediately. This weight loss is usually accompanied by other symptoms like fatigue, pain, or fever, making the situation more concerning. Your clothes may suddenly feel looser, and friends might comment on your appearance without you realizing the change. Don't dismiss it as stress or a temporary change. Unexplained weight loss needs proper medical evaluation. Doctors can run blood tests and scans to determine if cancer or another illness is behind the rapid weight drop. Spotting this symptom early can help catch bone cancer before it becomes more aggressive and harder to treat. 7. Fever or night sweats. Fever and night sweats can occur in bone cancer due to the body's immune system reacting to the tumor. You might experience sudden spikes in temperature without any infection, leaving you feeling hot, flushed, and uncomfortable. Night sweats can be so intense that you wake up drenched, needing to change clothes or bed sheets. These symptoms happen because cancer triggers the release of chemicals that affect your body's temperature control system. Many people mistake these signs for infections, hormonal changes, or stress, overlooking their potential link to serious illness. If fever and night sweats occur regularly and without obvious cause, they should not be ignored under any circumstance. When combined with bone pain, fatigue, or weight loss, they become a strong warning sign worth immediate attention. Your doctor may order tests to find out if these symptoms are connected to cancer or another underlying problem. The sooner you investigate, the sooner you can address the cause and prevent further health complications. Remember, your body speaks to you through symptoms, and it's vital to listen closely when it whispers or shouts. Final thoughts. Bone cancer may be rare, but when it strikes, it can change lives forever if not caught in time. The symptoms we discussed, pain, swelling, stiffness, fractures, fatigue, weight loss, and fevers, are your body's way of warning you. Even if just one of these signs feels familiar, don't ignore it or wait for it to go away on its own. Early detection gives you the highest chance of successful treatment and a better quality of life after recovery. Your health is worth far more than a moment of hesitation or fear about getting checked by a doctor. Think about your loved ones. They need you healthy, strong, and living life without the shadow of late-stage cancer. If you've experienced any of these symptoms for weeks without improvement, please schedule a medical checkup as soon as possible. And if this video has opened your eyes, share it with friends or family so they know these warning signs too. You might just save someone's life by passing this information along before it's too late for them. Stay informed, stay alert, and remember, listening to your body today can protect your tomorrow in ways you can't imagine.